coronavirus has exposed a lot of flaws in healthcare, including racial inequality. It plays a role in treatment, diagnosis, and ultimately outcomes in many different illnesses. And I spoke with the founder and CEO of Ms. Medicine, Dr. Lisa Larkin, about ways to better take care of minority women. Dr. Larkin, welcome back. It's good to see you once again.
Thank you.
You're active on social media, and I've been reading about your wish that this year is a turning point for our country when it comes to inequality in healthcare. What's your own experience with that?
Right. So I think the events of the last several weeks have really had a profound impact on me. And although I have been very focused professionally on advancing equality in healthcare for women, it's very clear that there are very large gaps and disparities in healthcare for underserved women and men, and that really we need to do more to advance health equality in terms of racial health equality as well. And I'm really committed now to trying to make substantial efforts to try to do that in addition to advancing women's healthcare.
And you're not just a doctor, you're also a breast cancer survivor. Talk to me a little bit about the disparity in preventing and treating breast cancer in women of color.
Right. So I am a breast cancer survivor. I am passionate about trying to educate and inform women to help them understand their own risk for developing breast cancer, how they can be more aggressive in terms of screening, what lifestyle factors impact breast cancer risk, understanding the possibility of having genetics contribute to their risk. What we know, though, is although all women are at risk, there are disparities in terms of race. We know that African Americans get earlier breast cancer of a type that's more aggressive, triple negative. We know that many underserved communities don't have adequate access to mammograms and testing. We know that they don't get the same care because of lack of access. And so really we have to do more to educate and empower the underserved community so that they can take proactive steps to make sure they're getting great health care.
So tell me a bit about how your practice is working to do that and about the community event you're planning to start bridging gaps and start a discussion.
Right. So as I said, the recent events have impacted me greatly, and I know that it's easy to say, and words, don't go very far in terms of, saying that I'm committed to working to advance racial equality in healthcare. It really needs to have, some meat behind it. And so my team and my practice, we've all been working very hard on thinking about really meaningful ways that we can start to contribute to, advance this mission of racial equality. So the first step for us, and we really have or we're working on having 4 steps, is to really do an educational event specifically targeted for the underserved community about racial differences in breast cancer and trying to educate and empower the underserved community to be more proactive with their health care.
So we have a link to that event and that discussion, so everybody who wants to can get involved at local12.com. Dr. Lisa Larkin, thank you so much.
Thank you.